Hello dear learners, today I welcome you all on the MCQ series from Pharmaceutical Chemistry on the chapter Histamine and Antihistaminic Drugs. The first question from antihistaminic drugs is histidine on dash gives histamine. Histamine is obtained from histidine, but by which process? Whether it is carboxylation, decarboxylation, oxidation or neutralization, which amongst these the process is used for the formation of histamine from histidine? So the correct answer is it is decarboxylation. Decarboxylation means this CO2 will be removed from the histidine, from the carboxylic acid group, and it will form histamine. Next question is the agents used in treatment of various conditions like allergic symptoms like dermatitis, pruritus, urticaria, running nose caused due to histamine release are called. जो ये conditions जो कि histamine release के वजह से होते हैं, जैसे कि allergic symptoms है, pruritus है, dermatitis है, तो ये conditions के treatment में जो agents use होते हैं उन एजेंट्स को क्या बोला जाता है? द फर्स्ट ऑप्शन इज हिस्टामिनिक ड्रग्स, सेकेंड ऑप्शन इज एंटीहिस्टामिनिक ड्रग्स, थर्ड ऑप्शन इज हाइपोग्लाइसेमिक ड्रग्स एंड फोर्थ ऑप्शन इज एंटी हाइपरलिपिडेमिक ड्रग. द करेक्ट आंसर इज इट इज एंटीहिस्टामाइनिक ड्रग्स. एंटीहिस्टामाइनिक ड्रग्स which are also known as anti-allergic drugs. Anti-allergic drugs means they are used in treatment of allergic symptoms. Next question is diphenhydramine comes under class. Diphenhydramine, according to the classification of antihistaminic drugs, there are various classes such as H1 receptor blockers, H2 receptor blockers. In H1 receptor blockers there are two subclasses, first generation and second generation. Now this first generation and second generation H1 antihistamines, from first generation diphenhydramine is there and the class is ethanolamines. The ethanolamines class is also known as amino alkyl ether class. Next question is what are the brands of chlorpheniramine? The brand names of chlorpheniramine, whether they are Bliscot, Candestine, Sinarest, whether they are Epitol, Sidale, whether they are Olax, and whether it is Sepmax or Trimfort. The correct answer is it is Bliscot, Candestine and Sinarest. Next question is which of the following drug stimulates appetite? Amongst these drugs, which drug is responsible for stimulating the appetite and it can lead to weight gain, since hunger will be produced, appetite will be stimulated, and therefore they are used in treatment of underweight persons. The drug, whether it is nizatidine, chlorpheniramine, cyproheptadine or promethazine, it is cyproheptadine. Next question is Avomine, Phenergan are the brands of, whether they are brands of chlorpheniramine, diphenhydramine, azatidine or promethazine. The correct answer is it is promethazine. Next question is what is the effect of histamine on blood vessels? Whether histamine causes vasoconstriction, whether it is not having any effect on the blood vessel, whether it is responsible for causing vasodilation, vessels dilation, whether it is responsible for causing only constriction. The correct answer is histamine is having a vasodilatory action on the blood vessels. Next question is histamine has a dash effect on the blood vessel. has a dash. It is secretory gland. So, and last option is it is, the correct answer is it is stimulating effect of a secretory gland. It will increase that is ethanolamine class and propylamine class. Propylamine is also known as alkylamine class. The correct answer for propylamine class is it is chlorpheniramine. Next question is, which of the following is not a second generation antihistamine? Whether it is terfenadine, chlorpheniramine, cetirizine, fexofenadine. The correct answer is the second generation antihistamine is it is chlorpheniramine. Next question is, antihistamines are cetirizine, levocetirizine, cetirizine, fexofenadine. It also increases the secretion of hydrochloride in stomach and it is responsible for causing peptic ulcers. Next question is, what is edema? Edema is nothing but whether it's a accumulation of water and fluid in the body, whether it is fluid buildup in the body, or both of them or none of them. So if you will see, first and second option is almost same. So both of them is the correct answer. Edema is, histamine causes edema, that is accumulation of fluid and water in the body. Next, to identify the given structure. Now it is really very simple. The first generation antihistamine which are there, in first generation antihistamine, it is, if you will see the structure, it contains 2 phenyl ring. And the name which contains 2 phenyl ring is diphenhydramine. Now this is amine and this is diphen. So indomethacin it is not there, ibuprofen is also not there, aspirin is also not there. The correct answer is it is diphenhydramine. This structure is diphenhydramine, which belongs to the class ethanolamines or amino alkyl ethers. Amino, this is alkyl and this is ether. Next question is, first generation antihistaminics are generally used in treatment of First generation antihistaminic, whether they are used in treatment of allergic disorder, whether it is in case of peptic ulcer, whether in case of both, or whether none of them. The correct answer is first generation antihistamines are generally used in case of allergic disorders. Next question is H1 antihistamines, that is first and second generation, are generally used in treatment of H1 antihistamines, that is belonging to both first and second generation, are generally used in treatment of what? Allergic disorder, peptic ulcer, both of them, or none of them. The correct answer is it is allergic disorders. Next question is histamine mediates its action through which receptor? Whether it is dopamine receptor, whether it is simple histamine, whether it is histamine receptor, or whether it is GABA receptor. The correct answer is it is histamine receptors. Next question is antihistamines are also known as, whether they are also known as anti-allergic drug, anti-hyperlipidemic drug, diuretics, or antiamoebics. The correct answer is it is anti-allergic drugs. Antihistamines are also known as anti-allergic drugs. Next question is antihistamines are used to suppress which of these? Whether antihistamines suppress allergic disorder? Yes, they can suppress. They are used in treatment of allergic disorders. Skin disorders? Yes. Motion sickness? Yes, it is possible. The correct answer is it is all of them. Antihistamines can be used in all the three conditions. Next question is sodium chromoglycate acts by. Now this sodium chromoglycate, whether what is the mechanism of action? The options are whether it acts by inhibiting the histamine release, whether it acts by increasing the histamine release, whether it interferes with the storage of histamine, or it is none of them. The correct answer is sodium chromoglycate acts by inhibiting the histamine release. That means it will stop the histamine release and it will act as basically anti-histaminic drug. Next question is Synarest contains which of these? Synarest contains, whether it contains indomethacin, ibuprofen, aspirin, or chlorpheniramine maleate. The correct answer is it is chlorpheniramine maleate. Synarest contains chlorpheniramine maleate. Next question is IUPAC of chlorpheniramine maleate is. The structure is chlorpheniramine maleate. This is the malic acid structure and this is chlorpheniramine. Now chlorpheniramine contains this pyridine ring and this is chlorophenyl ring, and the alkyl is propane, that is CH2 3 carbons, so it is propane, and NCH3CH3, that is dimethylamine. So since chlorpheniramine belongs to class propylamine, propylamine is also known as alkylamines. So if you will see both these names, so it is propanamine, okay, propanamine, that is propylamine, and dimethylamine, that is methylamine is alkylamine. So it can be named in two ways. It can be named according to the alkylamine suffix, and it can be named according to the propylamine, that is propanamine. So options will see. Now at the third position, 1, 2, 3, first carbon, second carbon, third carbon of propyl. So at the third carbon there is a presence of chlorophenyl ring and presence of pyridine ring. Both the rings are present at third carbon. At third position there is presence of one substituent which is known by the name chlorophenyl, and this is pyridine 2-yle. Why it is 2-yle? Because nitrogen is present at Actually numbering should start from this, but the attachment is on this position. So it is 2-yle, pyridine 2-yle, and this is propyl, and this is dimethylamine. And in second, if you will see, till now here it is same, only the difference is there in case of propylamine and alkylamine. This is alkylamine, this is propanamine, that is dimethyl propanamine, dimethyl propanamine. So it is propylamine, and this is alkylamine. So the correct answer is, it is both of them. Next question is, H2 antihistamines are generally used in treatment of, whether it is used in treatment of allergic disorder and GERD, peptic ulcer and GERD, both of them, or none of them. So majorly H1 antihistamines are used in case of allergic conditions, and H2 histamines are used in treatment of peptic ulcer. So the correct answer is, it is peptic ulcer and GERD. GERD is nothing but gastroesophageal reflux disease. So sometimes whatever the acid from the gastric region or the stomach region it is there, it will come back, or it will revert back to the esophagus. So the name is gastroesophageal reflux disease. So this is the condition. This condition can also be treated by H2 antihistamines. Next question is, promethazine contains which of these heterocycle? Whether promethazine contains PTZ heterocycle, whether it contains xanthine heterocycle, whether it contains acridine heterocycle, or none of them. The correct answer is, it is PTZ heterocycle, that is phenothiazine heterocycle. Next question is, which of the following is a first generation H1 antihistamine? First generation H1 antihistamines are like chlorpheniramine, then from the propylamine it is chlorpheniramine, and ethanolamine it is diphenhydramine. Two antihistamines. So the correct answer is, it is chlorpheniramine. Next question is, which of the following is not a second generation H1 antihistamine? The second generation, this terfenadine, cetirizine, fexofenadine is second generation H1 antihistamines are cetirizine, levocetirizine, fexofenadine, terfenadine. So these all fexofenadine, cetirizine, terfenadine are second generation antihistamines. And which one is not then? The correct answer is, it is chlorpheniramine. Chlorpheniramine, not cetirizine. Next question is, receptor blocker. Which of the following is a H2 receptor blocker? Now H2 receptor blockers basically include the examples such as ranitidine, famotidine. All these examples are there in the H2 receptor blockers. So the correct answer is, it is ranitidine. Ranitidine is one of the H2 receptor blockers. Another H2 receptor blockers are cimetidine, famotidine, nizatidine. So the trick to remember H2 receptor blocker is California. C stands for cimetidine, FO stands for famotidine, R stands for ranitidine, and NI stands for nizatidine. Next question is, ethanolamines are also known as, whether they are also known as amino-alkyl ethers, propylamine, alkylamine, or none of them. The correct answer is, ethanolamines are also known as amino-alkyl ethers. Next question is, propylamines are also known as, alkylamines. The correct answer is, it is alkylamines. Next question is, Benadryl brand contains, whether it contains diphenhydramine, chlorpheniramine, cetirizine, or ranitidine. The correct answer is, it is diphenhydramine. Next question is, identify the structure. Now in given structure, the heterocycle is phenothiazine. So, and options are promethazine, chlorpheniramine, cetirizine, or ranitidine. The correct answer is, it is promethazine, because promethazine contains phenothiazine heterocycle in it. Next question is, histamine is produced by, whether it is produced by mast cells and basophil, whether it is produced by guard cells and basophils, whether it is produced by nephrons and basophils, or it is produced by dust cells and basophils. The correct answer is it is produced by mast cells and basophils. Next question is, histidine on decarboxylation gives, correct answer is it is histamine. It can be asked two ways, histidine on decarboxylation or histamine. The first question, very first question which we have seen, histidine on dash gives histamine. So it is decarboxylation. Next question is, which of these is a physiological action shown by histamine? Whether it shows stimulatory effect on excretory gland, stimulatory effect on blood vessel, relaxation of smooth muscle, or none of them. So according to the physiological actions we have studied of that of histamine, it is stimulatory effect on excretory gland is the correct answer. It is responsible for increasing the excretion through various excretory glands such as lacrimal secretions through lacrimal glands, bronchial secretions, nasal secretions, etc. Next question is, dash is used in wheel test. Now wheel test is a diagnostic test which is used generally for vascular disease conditions, means to test whether the person is suffering from any vascular disease or the person shows any sign of a vascular disease. The wheel test, generally in this case histamine is injected to the patient intradermally, and in wheel test if the normal patient is there, then that normal patient, on the skin of that normal person where the histamine is injected, it will show a reddish spot within 2 to 5 minutes, and if there is a delay in appearance of the reddish spot, it is considered as the sign of vascular disease. So histamine is used as a diagnostic agent in wheel test. With this, we finish with few of the MCQs which are possible on histamine and antihistaminic drugs. Thank you.